We're going live. All right, then we're going live. Hello, everybody. It's Dr. Alex Earl here. We're at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl, the OG, original GOAT, as you guys know. All right, so this is the time I'm going to spend with you guys and talk about plastic surgery subjects and, of course, answer all of your questions. And today I thought we'd talk about something that we do every day, but it always comes up, and so I wanted to kind of go into detail regarding the tummy tuck, okay? So we're going to go into detail regarding the tummy tuck. We're going to talk about kind of what it is, the definition, how many different types there are, how to prepare, what to expect in the operating room, and what to expect after the surgery as well. All right, so we're going to do a comprehensive talk here on the tummy tuck, which is technically called abdominoplasty. Okay, so you may see that term there, abdominoplasty. That is the technical term for the tummy tuck. Okay, all right, so tummy tuck, what are the different types? So there's not just one tummy tuck. It's actually a bit more nuanced than that. So there's actually several types of tummy tucks, and what type of tummy tuck you get really depends on your physical exam, okay? It depends on that more than anything else, so it's kind of objective there. So it's not so much like there's a menu of tummy tucks and you can just choose the one you want, okay? Because it really depends on how much, for example, loose skin there is, how much muscle separation there is, things of that nature, in order to determine what would be the best type of tummy tuck for you in particular, okay? So what are the different types? I wrote them down here. So you have your mini tummy tuck, your full or your regular tummy tuck, which is the most common. Then you have your extended tummy tuck. And then another couple types are your fleur-de-lis and your high definition or HD tummy tuck, okay? All right, so mini tummy tuck, what is that? So a mini tummy tuck is actually for only a small subset of patients. Not everyone will qualify for this because it has to be for a patient that has pretty much no issues with their muscles, okay? So they really can't have any muscle separation or weakness of the abdominal wall because the mini tummy tuck does not include muscle repair, all right? What makes a mini tummy tuck mini is not so much that the incision is a little bit shorter, it's that there's less stuff being done. So there's no muscle repair and the belly button is not being moved, okay? So there's typically no scar around the belly button. So who qualifies for a mini tummy tuck? It's basically people that just have a little bit of loose skin below the belly button, okay? So you have just a little bit of loose skin below the belly button, you have no issues with your abdominal wall or your muscles, then you can qualify for a mini tummy tuck. The incision is still going to be longer than your typical C-section incision, okay? So for a mini tummy tuck, it's still probably going to go from about here to here. It won't reach all the way out to the hips or certainly not go around the corner, but it's still much, significantly longer than your C-section type incision there. All right, so that's the mini. The next is the one that most people know, which is your full or your regular tummy tuck. So that's going to include an incision that does go from hip to hip. It's going to include a scar around the belly button because with that, you're going to have your muscle repair. You're going to have your, what we call umbilical transposition or the movement of the belly button. And of course, you're going to have your full-on lipo to the flanks and the waist. So it includes all that. Remember that here in the state of Florida, when you're doing a tummy tuck, any type of tummy tuck really, we are limited to how much fat we can remove via liposuction, which is only 1,000 cc's. 1,000 cc's, okay? All right, so that's your full tummy tuck. Now, how about extended? So extended is similar to the full tummy tuck. However, you have to then extend that incision so that it doesn't really just stop right at the hip area where you feel those little hip bones here, but it goes around the corner past the hip bone and towards the back. So that's your extended tummy tuck when it goes around the corner there. And that's for patients that have a little bit more of excess skin kind of out in the flank area, in the lower flank area, that need that extension there towards the back, okay? All right, so what's the fleur-de-lis? So fleur-de-lis is typically for a massive weight loss patient. So that's going to be a patient that has a lot of loose skin, and it's loose not only in this direction, so the vertical direction, but it's also kind of loose in the horizontal direction. And therefore, the incision is not just that lower incision down here, but it involves the lower incision here and a vertical incision that goes all the way up to the, what we call the xiphoid process, the bottommost part of your breastbone. So the incision goes from here all the way down to the pubic area and then all the way across from hip to hip. And that's your fleur-de-lis, which is basically your most, quote unquote, I would say aggressive tummy tuck, which is for patients, typically for the massive weight loss patient. I'm talking patients that have lost 100 pounds or more. Okay? And then finally, your HD or high definition tummy tuck. So that's where we basically typically combine either a mini or a full, all right, with some high definition, and we're able to kind of etch out, if you will, the abdominal muscles at the same time. So we create that nice little line here in the middle. We kind of etch things out along the sides, create those kind of nice looking, feminine looking abdominal muscles there. So it is possible to do an HD tummy tuck, or it's also possible to do a tummy tuck, and then if you're going to come back for your lipo or BBL, to do your HD at that time. Okay, so simply because you have a tummy tuck, you can still have your high definition lipo. In fact, you have a much better chance of having a high definition after removing all the loose skin than if you still have that loose skin. If you have loose skin, I'm going to tell you you're not a candidate for HD, because HD does not work with loose skin. Okay? All right. Okay, so what are the patients who are the patients that typically get a tummy tuck? Well, it's usually either weight loss patients or post-pregnancy patients. Those are the most common. The most common is either weight loss or post-pregnancy. Okay? However, it doesn't have to be, right? You can get a tummy tuck and never had a kid, all right, and never lost massive amount of weight, okay? Because genetics plays a role, and if you have any degree of skin laxity, or if you have just a loose abdominal or a weak abdominal wall, those are still reasons to have a tummy tuck, okay? So it doesn't have to be. But what qualifies you as a patient? Well, you have to have the loose skin, you have the separation or weakness of the abdominal wall. You have to be healthy, okay, generally healthy. Your BMI cannot be too high. My max BMI is 30, okay? So you want your BMI to be 30 or less. In order to have the best long-term results, you want to be at your ideal weight. Meaning, you don't want to do a tummy tuck and then lose a ton of weight, because things are just going to get loose and flabby once again. Okay? So you want to be at your ideal weight at the time of the tummy tuck there. Certainly no smoking. We cannot have any positive nicotine when you have a tummy tuck. Okay? If you have positive nicotine coming in for a tummy tuck, you will get canceled. Okay? Why is that? Because nicotine constricts the blood vessels. It means less blood flow, less nutrients, less oxygenation for this long incision that needs to heal, which is going to lead to problems like the skin dying, skin necrosis, or the wound breaking down, just wounds not healing well. Okay, so definitely no smoking. Also no estrogens. You can't be an oral contraceptive. Nothing that has estrogen in it. Okay, for 30 days before a tummy tuck. Why? Because with the tummy tuck, if you're on estrogen, the risk for blood clots goes way up. And that can be very dangerous. Okay, so no estrogens, no smoking. Please keep that in mind. Super important. Okay, all right. So what does a tummy tuck do? As we talked about there, it removes excess skin. It does the muscle repair, or plication is the technical term for that. So muscles that are either separated, we bring them back together, or if they're just weak, we strengthen them with that muscle repair, which typically involves like a very heavy internal suture, okay? Rarely it would involve some sort of mesh. All right, and then it's gonna contour the flank and the waist, because remember doing the liposuction to the flank and the waist area to give you more of that curvy shape, okay? I know I have a lot of patients that come to me and they're like, Dr. Earl, I really love your tummy tucks because you give that nice curvy shape. I've seen a lot of tummy tucks out there where the patient ends up being basically a box, right? Being very rectangular, very square. And I think that's why a lot of people are afraid of getting tummy tucks, because they feel that they're gonna end up kind of squarish. And my answer to that is that certainly no, it does not have to be that way. Okay, the tummy tuck you should end up with a nice, beautiful kind of hourglass shape. Okay, and that's what we can do for you here. So definitely we're going to contour that flank and that waist. Okay, what type of anesthesia? I do all my tummy tucks under general anesthesia. There may be some surgeons out there that do it under kind of twilight anesthesia with local. I don't really recommend that. It's a big surgery, a big incision. So I recommend doing it under general anesthesia. Plus, when you're doing that muscle repair, you want that patient to be completely relaxed, right? You want the abdominal wall to be as relaxed as possible, so you can really make that nice and tight so the abdomen will be as flat as possible after surgery, okay? So I do recommend the general anesthesia. I use drains, okay? So I use 2 drains for my tummy tucks. I prefer using the drains because I think there's some issues with what they call the drainless tummy tucks, okay? In order to do a drainless tummy tuck, what you have to do is you have to put a bunch of little internal stitches, which are called quilting sutures, okay? That's the only way, because you have to kill or flatten out that dead space that you create when you do the whole dissection for the tummy tuck, okay? So when you put out all these little quilting sutures, a couple things can happen. One, if you get too near the skin, it can cause dimpling, which doesn't look good. 2, these sutures typically need to be permanent sutures, and if one of them gets infected, it's a big mess, because you basically have to kind of like open up the entire incision to go in there and pull out the infected suture, so you really don't want that, okay? And 3, from a surgeon point of view, it just takes a lot more time. And I don't like to keep my patients under general anesthesia longer than 3 to 3.5 hours, okay? So for all those reasons, I don't do the drainless. I use 2 drains. They're typically in 5 to 7 days for most patients. Some patients do require them longer, but it's typically not too bad. Then you get the drains out and you're good to go. Okay. All right. As with any surgery, post-op care is half the battle, right? It's just as important as the surgery itself. So if I can do this beautiful surgery, but if you don't take care of it afterwards, it's going to get completely ruined, okay? So you definitely have to wear some compression. At the beginning, you're going to wear this abdominal binder, this kind of white thing that wraps around you. Here are a couple key notes about the binder. The binder is just there to hold things in place and give you a little bit of support. It's not a waist trainer, okay? You don't want to crank up that binder. I've had patients where the surgery goes beautiful, all right, and then they put that binder on way too tight, and then there's issues post-op where there's not enough circulation to the areas that are healing, okay? So you don't want this binder to be too tight. It is not a waist trainer. It's basically there just to give you a little bit of support and to hold things in place, okay? Once the drains come out, then you can switch to your faja, okay? And your faja, now you're probably about a week or a few days, 7 to 10 days after surgery. Now it's okay. Now your faja can be tighter and can give you more of that, more of that compression. Okay? All right. There are massages with tummy tucks. So we do recommend about 10 massages with your tummy tuck. They're not as many, not as intense as when you do lipo or BBL, but we do recommend about 10 massages after your tummy tuck. At the beginning, they should only be to the flanks and the waist and the lower back. Not in the front area where you have your incisions for the belly button and your lower incision here, okay? So just in the waist and in the lower back. Why the lower back? Because after your tummy tuck, if you're tight, you're gonna be walking kind of hunched over like this, and you start to develop some spasms of the lower back, so the massages help relieve that for you, okay? And of course along the thighs and the waist, because those are the areas where we did the liposuction. So I recommend about 10 massages after your tummy tuck. Drains we talked about, you're gonna have your 2 drains, and really how fast we get them out really depends on how quickly you heal and how much fluid is coming out, okay? Walking after this procedure is incredibly important, okay? The number one, or the most, not number one, but the complication that we dread the most with this procedure is blood clots, DVTs and PEs. So the way to minimize that risk is to walk. So you have to be up and walking. You want to walk at least 10 minutes every hour while awake. We give all our patients here at Pure Plastic Surgery a device for the legs called the Vena Pro. It's a sequential compression device that helps keep the circulation moving, which is very, very important. You have to wear this device for the first 2 weeks, which is also going to help minimize the risk of blood clots, okay? So between the device and the walking, the risk should be pretty low, but you have to do it. You have to be religious about wearing that device, and you have to be religious about your walking, because we really want to prevent any issues with blood clots, okay? All right, so yes, like any surgery, the only way, like I've said many times before, the only way to have 0% complications is to not do surgery, right? So of course we want to minimize the risk of complications as much as we can, and we do a great job of that here at Pure. As you all know, patient safety is our #1 priority, but it doesn't bring the risk to zero. It can never bring it to zero. So can there be potential complications with the tummy tuck? Certainly, all right? The one that we dread the most are the blood clots. DVTs are the blood clots that occur in the legs. It's called stands for deep vein thrombosis. And then you have pulmonary embolus. That's when a clot travels to the lungs and essentially, quote unquote, clogs up the lungs, okay? This can potentially be fatal. That's why we have to be so diligent about the walking and using that VenoPro device, okay? If a patient has surgery and does not walk at all, if they go on, say, for example, a 5-hour or longer car drive and they don't get out to walk at all, okay? You know, if they go on a flight and it's under 5 days from surgery, so say you have your surgery and then in a day or two you hop on a plane and you don't walk on the plane and you don't have the VenoPro device, you can get a blood clot as well. And like I said, extremely dangerous. These blood clots can potentially be fatal, okay? So patient compliance is key. You have to follow your surgeon's instructions to minimize this risk. That's incredibly, incredibly important. Okay? All right. The next probably most common one is probably a seroma. That's having just a little bit of fluid accumulate inside, and if we see a seroma, typically we'll put a needle in and aspirate it. That's why you don't want to get your drains out too soon. You know, if you get your drains out before they're ready, then the risk of seroma goes up, okay? Next, infection. All right, I've done a couple talks and I've done some TikToks and everything else on infection. So who out there knows what's the #1 cause of infection with a tummy tuck?
Give some time.
Let's give some time there. I know I've done a couple TikToks. People that are following me, they'll probably know this one. Number one reason for infection after a tummy tuck, okay? We'll get back to that and see if everybody answers. Next one is probably bleeding. All right. Typically, there's not a lot of bleeding with the surgery. It's all under direct vision, which means I can see exactly where I'm going. Okay. So blood loss is not too bad.
We have 2 answers.
All right. Let's see.
First one, not cleaning.
Okay.
Or dirty belly button.
There we go. Dirty belly buttons. That's right. Awesome. Great job.
Jen.
Great job. Okay. Let's send some likes and is it Jen?
Jen.
All right. Let's send her some likes. Maybe TikTok, we could send her a dinosaur or two. But that's exactly right. So dirty belly buttons, #1 reason for infection with a tummy tuck, okay? People, please clean those belly buttons, okay? You should clean them every day, but especially if you're gonna have your tummy tuck starting at least a week before surgery. You wanna get in there, get your finger in there, get the soap in there. If you need a little Q-tip because it's deep, get that Q-tip in there, but you wanna clean those belly buttons, okay? You can't imagine how many times we have people here for surgery and we go to, because you know, we also clean, we go to clean the belly button and it has like gunk and like little rocks and just like nastiness in there, okay? You don't want that because it can really increase your risk of infection, all right? So make sure that belly button is pristine before your tummy tuck, okay? It's the #1 risk for infection, all right? We talked about bleeding, scarring. So there's a lot of, you know, people are always afraid about the scar, okay? It is a long scar, and we have to take care of it. So starting at 2 weeks post-op, we have to use a silicone-based scar cream, all right? And we have to do that diligently twice a day, every single day, to try to get those scars to be as nice and thin as possible, okay? But there are some patients that have genetic predispositions to hypertrophic or keloid scars, and that's always a possibility. The area actually that's where you most commonly would get a keloid scar is the scar around the belly button, unfortunately. So that is one of the most common areas there. So that scar cream needs to go to the belly button as well, starting at 2 weeks post-op, and you can also start belly button training at 2 weeks post-op as well, okay? Dog ears are kind of related to scarring. That's when you have a little excess skin left on the sides, and that's why, you know, if you're someone with a lot of excess skin and we need to do that extended, then it's best to do that. It's best to bring that incision out a little further, even though the scar is longer, to prevent the little dog ears there, okay? But bringing out the scar a little further, plus doing lipo to that area, helps kind of minimize the risk of dog ears, though, you know, it's always a possibility that you may get them. If you do, it's not usually a big deal. Typically, we can have you come back for a little dog ear excision under local anesthetic, so a little like in office procedure, very very quick, no anesthesia, no general anesthesia required. Okay, and then these are the ones that you see if the surgeon is too aggressive, or if the patient is smoking or on estrogens or things like that, okay? And that's your skin necrosis, which basically means skin dying, okay? Or wound breakdown, basically the wound doesn't heal and it opens up. What are some reasons for that? If you involve too much liposuction at the time of your tummy tuck, especially in the central area, then that's like a double hit to that skin there, because you're lifting up that skin to then stretch it down and cut off the excess, and then you're doing liposuction on top of that, and that can certainly lead to the skin not doing well, to the skin dying, and then creating an open wound, okay? What's another reason for skin necrosis? If you put on that binder too tight initially in that first week or 2 weeks. If you're too tight, you're going to cut off the blood supply, no oxygen, no nutrients, skin dies. Okay? Another reason, if you're smoking, nicotine causes vasoconstriction, the blood does not flow through the vessels well. Again, no oxygen, no nutrients, skin dies. Okay? So these are a lot of things you need to take into consideration in order to kind of minimize that risk. I never do liposuction in this central area at the time of the tummy tuck because I want to minimize the risk of skin necrosis as much as possible. Okay? All right. So I think that was pretty comprehensive. I probably answered a bunch of your questions regarding tummy tuck already, but I'm happy to answer any questions related to this or any other plastic surgery topic.
Okay, I will pick those that you haven't talked about, but
Okay.
they're from the topic like this. How do you know if I have muscle failure after a tummy tuck?
Okay, good. That's a great question. Thank you for that. So remember what we said here, the post-op care is just as important as the surgery itself. That's another thing. If the patient does any heavy lifting, strenuous activity, or even things you may not think about, like coughing, sneezing, straining, anything that causes increase into abdominal pressure and it's too soon, it may cause that muscle repair to fail. And if that muscle repair fails, sometimes the patient may, if it's something acute like a cough or a lift or something like that, they may actually feel like a tearing sensation in their mid-abdomen, or they may actually feel or hear like a popping sensation, okay? Sometimes it may happen at night or whatnot and you don't feel it, but what you'll see is that when your tummy tuck was nice and flat, all of a sudden then you have a little bit of a bulge, and that's a possibility too. So you have to be very, very careful post-op. No heavy lifting, no strenuous activity. Don't do anything that's going to strain that muscle repair.
Is there anything you can do to prevent dog ears on our end? She's 3 weeks post-op.
Right. So from the patient's point of view, really the only thing you can do is make sure you have your compression to that area, okay? Because it is also an area where we perform liposuction, and so then you need that area to kind of stick down. So if you're 3 weeks post-op, by that point in time, then it is okay to have higher compression. You should certainly be in your faja and make sure that your faja is definitely giving you adequate compression in the area where the dog ears might be.
Can I get lipo on my back and a tummy tuck at the same time?
It's only possible for certain patients, at least for us here in Florida. Remember, here in Florida, we're limited as to how much liposuction we can perform at the time of tummy tuck, which is 1,000 cc's is the max, okay? So if you're like a smaller patient, you're a little bit on the lower BMI side, and we can still stick to the 1,000 cc's by lipoing the back and the flanks and the waist, then it would be okay. But honestly, for most patients, if we just do the flanks and the waist, that's already 1,000 cc's, and we don't really have a lot more room to go in terms of like the back or any other large areas. Now, if you want to do a small area, say for example arms or chin, then that's a higher possibility there.
Doc, do you provide a faja after surgery, small enough for women that are petite and 4'10", and just wondering if I would have to bring my own?
No, we would have a faja for you. and or a binder. If we're talking about tummy tucks, you'll start with that binder, and then you'll have the faja. And if you're having Lipo 360 or BBL, we typically provide the stage 1 faja, and we have small sizes for our petite patients.
Could you explain again how long should you wear your faja?
The faja, yeah, okay. So for tummy tuck, I assume we're talking about that.
Yes.
So for the tummy tuck, once you switch over from that binder to the faja, you're gonna wear it pretty much night and day for the first 6 weeks, okay? And then after 6 weeks, you're gonna scale down to 12 hours a day, which is pretty much during the day while you're being active, and then you can take it off at night. Now, you're gonna do that till at least 3 to 4 months post-op. Now, I would say that's for, probably a lot of patients, but not all. The tummy tuck is one surgery where you do tend to have some swelling that can last a very long time. It could easily last 6 months, 8 months, even up to a year, okay? So it depends a little bit on how the patient's doing. Especially in that kind of central portion, that suprapubic area, it can last there for quite a while.
What's the recovery time for a tummy tuck?
So it's gonna be first 6 weeks, no strenuous activity, right? No heavy lifting, no sex, okay? During that time, it's gonna really take about 6 weeks before you really get back to regular life. In terms of driving, most patients are not gonna really feel comfortable driving until about 4 weeks post-op. For most jobs, if it's just like an office type setting, you'll probably want to take off at least 3 weeks. But if it's a job that's more like heavy lifting, like a nurse, firefighter, policeman, anything that involves heavy lifting, you're gonna want to take off the full 6 weeks.
How long after weight loss should you wait for surgery?
Great. So if you're undergoing weight loss, especially if you had a bariatric surgery, such as like a gastric sleeve, gastric bypass, then you're going to want to wait. The minimum is really going to be 6 months, but it's really all about the weight loss and reaching that plateau. Kind of once you reach that goal weight, you want to be at that goal weight for at least 3 months before then having your surgery, okay? Because what you don't want is to have your surgery and then you lose a ton of weight afterwards. You're not gonna like your long-term result because everything's gonna loosen up once again.
If a patient don't want tummy tuck, would you still do a BBL?
So it depends on the patient. So it really depends on how much loose skin there is or how much muscle weakness there is. Okay, and it's a conversation that we have with the patient because they really need to understand what the outcomes will be. If there's some degree of loose skin or muscle weakness, I typically almost always recommend doing the tummy tuck first, okay? That's really the best way to do it. It's going to provide you the best result. All right, now of course there are some patients that, they don't want to do a tummy tuck. They want to avoid the tummy tuck scar. Okay, but you have to understand that when there's skin laxity, right, when there's loose skin, with liposuction, a lot of times that skin will not retract well. And if the skin doesn't retract well, it typically looks lumpy, bumpy, wavy, or uneven, okay? And this unevenness is not because there's uneven lipo, okay? It's because the skin didn't retract well and it's loose in certain areas and adhered in other areas, and so it looks uneven, it looks lumpy, bumpy, okay? And so then the only way to deal with that afterwards is going to be with a skin tightening procedure such as a tummy tuck, okay? But much better, you'll get a much better result doing the tummy tuck first and then your Lipo 360 or BBL.
And the last one, Doc.
Yeah.
How long do you have to stay in Florida after a tummy tuck?
So you're going to be here, total is typically about 7 days, but the key is that you have to be here at least 5 days post-op. That's really the most important. So you can't, hop on a plane or leave Florida for at least 5 days after surgery. So why 7 days? So you have your pre-op day, which is the day before surgery. Then you have surgery day, and then 5 days, which typically for most patients is a 7-day stay in total.
Oh, no, this is important. This last one. How long do you have to be hunched over after a tummy tuck?
That's right. So very good. So after a tummy tuck, you're going to be walking kind of hunched over like this. When you're sleeping, you want to sleep in either a recliner or you want to have 2-3 pillows behind your back, a couple pillows underneath your knees to relieve some of the tension along that muscle repair and along the skin that's been pulled down tight. It varies a little bit from patient to patient, but typically you're going to be walking hunched over anywhere between 1 to 2 weeks. Okay? What, that's it? 30 minutes already?
Yes, sir.
All right.
30
Awesome.
minutes, 30 seconds.
Excellent, excellent. All right, everybody. Well, I hope this was helpful. This is pretty much a comprehensive view of everything you need to know about tummy tucks. And again, if you missed some or all of this, make sure you go to our YouTube channel. Okay, go to YouTube. Go search up Pure Plastic Surgery. I have a ton of videos there. Pretty much any plastic surgery topic you can come up with, it's there. Pretty much any plastic surgery question that you may have, there's an answer there. So please go check it out. All right, everybody. Well, I will catch you all next week on Hump Day with Dr. Alex Earl. Ciao.